Oh man, I feel so bad. I should not have had a bagel for breakfast.
Hi Charlie, how are you feeling today?
Doc, I've been better.
What's been bothering you?
Well, I've had a lot of bloating, and with that comes like flatulence and diarrhea.
How long have you been having this for?
Past couple of months, it's really picked up. It's been kind of gross, so I figured I'd have you come and check it out.
Yeah, does it happen after you eat anything specific or you've been doing any certain activities?
I can think of, I eat a lot of pasta and toast, and I love having bagels for breakfast, so I think I notice it most after that.
Well, it may be something gluten related. Why don't we check you for celiac disease? We can run a couple tests, like a DNA test and antibody test, and see how that turns out.
Oh, okay. But what is celiac disease?
Why don't you let me show you?
Celiac disease is an autoimmune disorder that activates all three parts of your immune system when you ingest prolamins in wheat, barley, or rye. Prolamins function as a storage protein in grain, with the most prominent example being gluten found in wheat. Gluten proteins are divided into two groups, gliadins and glutenins, with gliadins being the proteins that are most responsible for causing celiac disease. Gluten can be found in many things you may not suspect, ranging from food to hygiene products. Some things to stay away from include bread, deli meats, beer, soy sauce, toothpaste, and even pasta.
After ingesting gluten, it travels through your digestive system, undergoing mechanical and chemical breakdown. It avoids complete digestion by the peptides pepsin, which is located in the stomach, trypsin, and chymotrypsin, which are both located in the small intestine. It does this due to a high amount of glutamine and proline residues that make it up. When gluten reaches the villi of the small intestine, which functions to absorb nutrients, it binds to epithelial cells and induces the release of zonulin, loosening tight junctions between the epithelial cells of the small intestine, allowing for the influx of gluten proteins into the lamina propria.
Here, gluten binds to the enzyme tissue transglutamase 2 that processes gliadin peptides through deamidase and transamidase activity. This results in the transformation of glutamine residues to lysine and glutamate, changing the charge of the peptide, allowing for binding to the antigen-presenting cell receptor. The conversion of lysine via transamidation is more common, and the conversion to glutamate occurs when there is a low pH, like when there is inflammation occurring or when there are low levels of lysine.
Antigen-presenting cells found in the lamina propria have specific MHC class II receptors. When antigen is presented by the MHC class II receptor, the antigen presenting the cell secretes interleukin-15, a pro-inflammatory cytokine. The MHC receptors are HLA, DQ2, and DQ8, and they present the antigen to the CD4 helper T cell. About 90 to 95% of all celiac patients possess the alleles that code for one of these two receptors. The CD4 helper T cell secretes interferon gamma, another pro-inflammatory cytokine, that initiates inflammation in the intestinal epithelial cells.
After IFN gamma has been secreted by APCs, it binds to CD4 positive Th1 cells, which become activated. These activated T cells can then go on to secrete other pro-inflammatory cytokines such as IL-12, IL-15, tumor necrosis factor, and also IFN gamma. IFN gamma is the main effector molecule in celiac disease, as it is responsible for activating not only Th1 cells, but also TFH cells that then go on to activate B cells.
Intraepithelial lymphocytes are CD8-positive cytotoxic T cells that bind to gliadin in the lamina propria and migrate in between epithelial cells. They then become activated once they are bound by IL-15. This activation causes the expression of NKG2D, a co-stimulatory signal that lowers the activation threshold of IELs to self-antigen. This causes the IELs to act as natural killer cells. They kill the epithelial cells, eliminating villi. IL-15 also prevents the differentiation of Tregs, thus eliminating the chance for tolerance forming.
The T follicular helper cells present the modified gliadin which activates B cells. This causes proliferation of further B cells. The follicular helper T cells also cause isotype switching by changing constant regions on immunoglobulins to produce both IgA and IgG antibody isotypes. IgA antibody isotypes include anti-gliadin and anti-tissue transglutaminase antibodies. IgA antibodies are found primarily in the intestinal mucosal membranes. IgG antibodies are also anti-gliadin. They are the most common and most effective isotype. Both antibodies then create an inflammatory response and continue to produce IL-15, the pro-inflammatory cytokine.
3 tests are used to confirm a diagnosis of celiac disease. Enzyme-linked immunosorbent assays are used to detect the presence of anti-gliadin and anti-transglutamase antibodies in the blood in a patient's serum produced by B cells. Also, since 90 to 95% of celiac patients have HLA-DQ2 and HLA-DQ8 receptors, PCR can be used to detect for the alleles in a patient's DNA. Lastly, a biopsy of a patient's intestinal villi can be analyzed for atrophy and compared to the Marsh scale to determine the severity of the disease progression. Hi, Charlie. After looking at the results of your ELISA test, DNA screening, and your biopsy, it's confirmed the diagnosis of celiac disease.
Oh man, alright. Well, what does this mean for me now?
Well, it means you should avoid trying to eat gluten as it can cause inflammation inside your small intestine and cause a lot of other health problems, including malabsorption of nutrients, osteoporosis, and cancer.
Oh man. Well, thanks, Doc.